everyone, this is Jason with Dr. D CBD. I'm here with Dr. D.Don Davidson, MD himself. What's up, Dr. D?
Hi, everyone. Happy Thursday.
And we have
from Las Vegas.
That's right. And we have two very special guests. We have Dr. Alavi and Jasmine.
Aloha.
Aloha.
How y'all doing? I'll let you introduce Dr. Alavi and Jasmine. Dr. D, take it away.
Yeah, absolutely. Well, what a couple of special ladies to have on the show right now. This is a special show for me because Dr. Alavi and I work together on the platform EaseMD in California. And it is just really, really neat to be able to reconnect with her and to see where our journeys have taken us through connecting originally on some really dynamic and I would say kind of revolutionary telemedicine systems in California. And then, where we've all come from there and where Dr. Alavi really got into this holistic sort of healthcare. So Dr. A, I know you've worked as an integrative medicine doctor. You've worked on different telemedicine platforms. You've worked with CBD and cannabis. How did your journey really start, into these kind of specialized areas of medicine?
Mm-hmm. Well, first of all, thanks for having me, Dr. Davidson. It is a total pleasure and an honor to be on the show. I love that we're reconnecting in this very forward-looking fashion.
Yeah,
and that would be summing it up. It would be forward thinking. That's just since as early as I can remember, I think the things that I felt passionate about, like natural healing, were all in the works. And on average, it's been like 7 years later, I've seen them manifest, and now that's speeding up. So when I was in medical school, just found
everything before this for now.
Yeah.
Everything before this for now. So yeah, you got a little didn't mean to cut you up, but yeah, I totally agree with you on this kind of path of these new forward-thinking modalities, telemedicine, and it taking a few years, and sometimes the first go-round is almost practice for, where you're really going to find yourself. But yeah, go ahead. So
we were certainly, I noticed when we met, we were certainly on to bigger things than what the current medical complex, I would say, had accepted or was beginning. Now I live in the world that I've always wanted, where you can walk into a store, essentially, an establishment, and purchase natural plant medicine. And so seeing that that's my trajectory, that's my passion, I say yes to those opportunities. And so working on the platform with you definitely was in alignment with that. And working again with you now is in alignment. The research that I'm helping conduct, looking at MDMA for the treatment of PTSD and psilocybin for the treatment of severe resistant depression, are both along that path. And it's just,
and that would be such exciting research too to share, because the same thing with THC, right, of how this is interacting with brain or stimulating plasticity in brain. And actually Beyond THC is an excellent resource. Some users or some people watching may have heard of it, and maybe you have too, but it's a lot of the Society of Cannabis Clinicians, and they just published a really neat paper and some research on there showing how THC doesn't cause diminishing changes in hippocampal volume and things like that. But Dr. A, I think it's really neat. A lot of people, I think, that listen, they hear and they think of a doctor as a doctor. You're a Western trained doctor. You're an MD, the prescriptions, pills. And, you and I and the folks that have worked in California, especially, I feel like, because it is a progressive place, especially with folks that were open early on to cannabis and CBD, we really were exposed to this mentality by so many Americans that I don't think a lot of doctors necessarily feel or get, because people aren't as open with them about some of these feelings they share about Western medicine. And there's kind of this almost backlash that's happening and distrust of doctors or pills and things like that. And so I'm interested in, how did you, when you were in med school, go from, med school to a residency? And then, what does really integrative medicine mean for people that don't really understand that? And how do you go from, being a regular doctor to doing that? And how does that help folks?
Well, I really wanted the strongest background I could get. So I knew, coming from a Western standpoint, I'd have the science down, I'd have the reputation and the degree, basically. So people would listen. They would believe me and trust me. But I have to tell you, the majority of my toolbox has come outside of the med school classroom, where you only learn 4 hours of nutrition. I mean, that is inadequate, as I really feel that food is thy first medicine. And so how do we learn to take care of ourselves in a holistic manner so we don't rely on the medical complex? So we don't need to be hospitalized. So we don't need to learn too late after someone's been stented and already had, major cardiovascular strategy, performed on them. So.
Yeah. And so I'll jump in there too. That's something that, you have to watch what you say with CBD so much, right? And not make any claims or not. But yeah, getting people on these integrative lifestyle changes, diet, and being able to understand what is it that are in these plants that are actives that are having impacts on human health, and being able to convey that to young people really is, I think, one of the most important jobs for us as doctors with this new kind of armamentarium of plant medicine, of things we can derive from hemp and other plants, and the understanding and being able to go out there and share with folks that, listen, if you're predisposed to coronary artery disease, the autopsies from studying young people that have died show those changes start when you're in your 20s in the endothelium of your arteries. So if you're going to take a strategy where you're going to take something anti-inflammatory like CBD, or you're going to do a lifestyle change like diet, or you're going to go talk to a doctor like Dr. Alavi and work on integrative functional health strategies, it's really important to start when you're young.
Mm-hmm. Yeah, certainly. I think a lot of that is mirrored by family units, and how do you take care of yourself and your family? Are you going to take the approach of fearlessness and love-based compassion towards yourself, and talk to people about how you can get healthy through natural means? Are you going to choose a less involved approach where you're kind of handing over your power to a pill? And granted, some people need those medicines, but I feel that even the World Health Organization agrees that the majority of illness is stress related. So there's a mental component that just hasn't been addressed for so long. And indigenous cultures knew this. And that's why mushrooms have been used in their medical practices for, thousands of years. We think maybe even 10,000 years. And that spiritual aspect is finally infiltrating the Western mindset. So, and what I mean by that is a lot of these medicines, THC, cannabis as well, are psychedelic. They're mind manifesting. Oh, she loves this part. She's like, I agree. They bring up what's been repressed in the mind.
I love it. You know what? And you are welcome to bring her on the show whenever you want, and she can cry as much as she wants to, and that's just fine.
Oh, she's a happy baby. Yeah, she's great. She really loves it. And I think babies are, tripping the whole time. They're with us until they learn to make sense of their environment. But
they must be.
Yeah, these plants are put here for a reason. And it's really that they're here to share their message, and we're finally listening. Like those indigenous cultures have known for many these plants. And I think a lot of it, Don, is related to the fact that the Western mentality and mindset has been disconnected from the spiritual one for a long time. And a lot of these THC included as a psychedelic because it really does help put you in a mind manifesting. It's called a mystical experience. So these medicines, and they'll have a connection. In other words, cannot be just. It has characteristics. Yes, it has characteristics. Great divine connection, a feeling of oneness, a feeling of peace, something that you can't put words on.
Right. And until recently, right? I don't think there was a lot of research that didn't necessarily get out there that was showing folks that these bad emotions and that this stress are actually, of course, chemicals in your body that can cause low levels of chronic inflammation and certain diseases over time, is a lot of the thinking. And these psychedelic drugs literally are basically providing anti-anxiety effects, reset, letting, and then do you want to comment on any of maybe the preliminary research that's out there for some of these psychedelic drugs, like either THC or MDMA, as far as, increasing neuronal plasticity, memory, or, helping extinguish fear pathways in the brains associated with PTSD?
Yes, they are certainly been proven neuroprotective, anti-inflammatory. Learning about all the different molecules. Women who don't use cannabis has CBD and has cannabinoids in it. So there's something. And what we found there is that these plants help us reach homeostasis. That the plant releases these oils in response to stress. And these oils are chemical profiles that we need to balance out in response to stress. So when someone's system has been so fried that they can't do it, cannabis can really step in there and give them the homeostatic or balanced body that they've been seeking with a little bit of help. So you know that very well. Moving on to mushrooms, what we think is happening there is that the brain in times of stress, in reactivity, has this amygdala response. That's the fear center of the brain. So a lot of like what coronavirus talk has been is very fear-based, right? Like the numbers aren't really showing that it's more serious than the common cold, but the fear and the activation of the amygdala and the stress response shrinks the brain. So you have this feed-forward cycle of stress. And that default mode network, so to speak, gets inhibited when you take these psychedelics. So when you're taking MDMA and psilocybin mushrooms, what we're seeing is that individuals are able to more objectively look at the place that they're in and recount the traumas they've had as an observer. And when those fear systems are downregulated, then they get the healing that they need because they can sit with the experience and kind of just let it pass through them, heal it, you know?
Yeah, be there.
So that's been really incredible. And we're finding that for MDMA specifically, it is actually curative of PTSD. I think the numbers are around like 60% of individuals who go through these specific treatments in a very supportive environment with a co-therapy team. They are having amazing responses, and some of them do not qualify for the diagnosis of PTSD any longer. So I think that's there's a lot amazing. To be said.
Yeah, there's a lot to be said for that. And I think it all, a lot of this is really, really important for people to see in the context of all the other sorts of side effects that the doctors that have to go through Western medicine see, right? We have to work with all these drugs, which, if the person doesn't respond well, their skin can slough, they can have major bleeding, all these sorts of things. And these are all
side effects.
And these are all acceptable every day in the hospital. Every day, that first year med school student is literally, the second year or the third year on the floor is the one responsible for sometimes signing off and checking the dose and pushing it. And the power of these things that have for really no reason gotten these negative connotations as bad drugs. Like, these things do not come into the same classification as something like cocaine or heroin. It is completely different. And I think the general public has to really begin to be educated and accept these things. Cannabis, magic, psychedelic mushrooms, these things are not in the same class as those other sorts of drugs. And in fact, they have some very potent healing properties. And, a lot of folks are using these things at home every day. Not under the preparation of a doctor or control of a doctor, and they are self-medicating, self-treating.
Right.
And that's one of the most, I think, kind of refreshing things for me to see in my, our age group, is more and more people using more cannabis instead of, alcohol and other drugs.
Yeah.
Sure.
Hey, so everyone, this is Jason again. Just wanted to remind you that you can actually call in and ask Dr. D, Dr. Alavi, possibly even Jasmine, a question live by calling 702-763-9518, 702-763-9518, or go ahead and enter your question below in the comment section.
Yeah, we'd love that. And then you can always comment even after the show, right, with questions, and we'll get back to you. So one of the nice things that we should definitely address here with Dr. A is that the original EaseMD telemedicine platform, which helped over 200,000 Californians get advice from a doctor and get their medical recommendation affordably, is relaunching as Dr. D Telemedicine today. Tomorrow, it's live. Emails are going out. So you can actually see Dr. Alavi. If any of you are listening to this and you specifically want to talk to her on the platform, all you have to do is go to the website. There's live chat. There's a phone number. You can ask, and we'll make sure that you get connected to her. And, the whole goal here is, again, to get people their recommendations so they can save on taxes. They can ask doctors about these products. And it's, it's rapidly evolving that you could ask a doctor like Dr. Alavi or I questions, way beyond just weed. It's not just weed or THC or CBD anymore. There are other compounds out there that are emerging that are now financially affordable enough for folks to buy. So things like CBN, CBG, CBDA, THCA, we're starting to actually see available in California and other states. So, that's neat, and we hope everyone takes advantage of that. And then, Dr. A, how did you find your way into, Florida with this new beautiful young lady? Your guys are kind of on a road trip down there, or going to work down there for a little while, or what's the status of the Florida trip? Oop, did we lose her? Yeah, that's okay. She was on a Wi-Fi signal down in
I'm back.
Oh, she's back. I was just kind of updating everybody on, EaseMD stuff. And then, so how did you end up down in Florida now? What's going on in Key West?
Yeah, so my partner, Jeffrey Clark,
hey, Jeffrey.
He's amazing. He's a musician. Yay. Yeah. Jeff.com. Yeah, he's great. So he booked a month that's like a work vacation month, but it's mainly work because he's just at the grind. But he loves his work. It's music. So he's playing like every night for, the past month or so. We'll be here for a month total.
You guys are you guys just starting, or you're just kind of finishing the month?
We have one more week. Yeah. We're here for one more week. Yeah, he's playing the Hog's Breath Saloon in Key West for the next few nights, and baby and I are here to support him and hang out, and also working on the side, which is great. That's what I love about telemedicine. I have that freedom. I can spend time with my baby and work intermittently when needed. So
yes, so that's another thing that's really powerful, right? To highlight is that telemedicine not only provides flexible service for customers, but for doctors that have, great things like families. It lets them also be able to be there for their families too, which is quite lovely.
Hey, Dr. D.
And then, Yeah,
so I'm just letting everyone know I put on the screen davidsonmd.com. And then also we have a question.
Yes.
They want to know about chronic pain, the topic of today's talk, and CBD, because back in the day, they were in a bus accident and they still have lots of pain in their neck. They go to a chiropractor and it helps, but it's still chronic. It's still there. They keep on having to get, massage and chiropractic treatment. So if Dr. Alavi could talk about chronic pain and CBD, that would be appreciated.
Sure. Yeah, take it away, Dr. A. I think it's a great way to set it up for like a nice kind of holistic treatment plan. The breakdown of how we incorporate CBD and other modalities into chronic musculoskeletal back pain. It's a great little topic.
Yeah, well, I know you're totally capable of handling this question, but my question for the caller would be, is there a way to combine a little bit of THC into your treatment? Strictly CBD, we're talking bodily relaxation. I think of C in the CBD as calming. And we know that adding a little bit of THC to that formulation will help with a lot of the mental side of pain, because we are working on a mental, emotional, physical body. And so when we add a little bit of THC, we're seeing that the CBD and the THC is synergistic, and they work together really well. So we get the calming effects and the bodily relaxation from the CBD. We also get the mental positivity and antidepressant effect of the THC. And we find this in topicals as well. So if it's chronic pain of a location that you can point to, a topical is great because you can apply it to the skin. If it's a more full body type of pain, I really like, sublingual method, because I think that you get longer pain relief and your onset is a little quicker than an edible, which goes through your digestive system first and can kick in even 3 hours after you take it. And of course, for short-term relief, if it's optional in your state to inhale, vaporization is great for that quick onset but shorter duration of relief. So a combination of those things is usually what I recommend to clients who call in.
Yeah,
what do you think, Don?
I'll echo that. I think a lot of people are not used to talking about like dosages and things like CBD, because so many doctors have been afraid to even talk about that for so long. So people hear these words of like CBD or THC, and they get confused. They hear ratios 1-to-1, 2-to-1, and the 1-to-1 is so good. And I think it's important to give people advice on that, right? That if you're brand new to cannabis, CBD, or THC as a modality of therapy or as a medication for yourself, that remember, if you're new, 1 to 2 milligrams of THC probably won't get you stoned, but it will, in research studies has shown to have, antidepressant or neuroprotective effect. So even if you're not getting high, I think it's important to get out there to folks that you can have that little bit of THC in there and still have a superior medication than just CBD all by itself. So maybe you're using a full spectrum product that has some THC in it. Oftentimes those products out there simply aren't in the right ratios. So you have to almost get a bottle of like a full spectrum CBD oil and then, a milligram or 2 mint or something like that. And then you can mix and match your dosages. So I think if people are able to, exactly what Dr. Alavi said, accept that THC and CBD both can work together and they can play around with them at different dosages. So maybe someone starts at 2 milligrams of THC in the evening and 50 milligrams of CBD. Something like that could be interesting. Topicals for sure. Again, full spectrum topicals, THC has been shown in the literature to be more anti-inflammatory than CBD. And then another thing that she said, these things are different compounds. They're working differently. They have different biochemical pathway mechanisms of action. So if you have THC, it might be, or it is doing different things for you to reduce pain. It's acting in different ways. So these are different. These are the real reasons why it's so important to be able to talk to someone like Dr. Alavi or listen to the show where we're talking about this and get comfortable talking about these things. Because the beautiful thing is, remember, even if you do take a little bit too much THC, you're just going to go home and lie down and rest and sleep a little bit. Especially when you're under the guidance of someone who knows what sort of milligram dosages, right? The people that have bad experiences with THC and things like that are usually the ones where one of their friends plays a joke on them and they give them an edible and it's 100 milligrams. And that's just not really very effective for anyone. So I think,
I like to say start low and go slow.
Right. Start low, go slow. And then,
Another question.
Yeah. Then the other things too, though, before I let everyone jump off, is it's so important when you go on the cannabinoids is to keep track of all your other medications and how much you're taking of those medications when you're starting your CBD and your THC, so that you may actually, with the guidance of whatever doctor has put you on these other medications, be able to reduce some of the toxic things that you have to take, whether it's pain control medications that you can reduce your usage of, anxiety medications, or whatever. And that has been absolutely right. One of the proven and most beneficial things of cannabis, that it has allowed people to come off of other medications. And then the one more thing, and then I'll take the next question, is that what Dr. A said about the psychosomatic or the mental aspect of pain, and how THC helps there. That's a really important topic that I think a lot of folks that are just not medically educated, they don't understand that there's parts of the pain experience and the neuronal synapses that are occurring in your central nervous system. So having the ability to have something that affects those circuits, not just like the site of the pain, is actually incredibly intelligent to want to put into a pain control regimen. So, yeah.
Mm-hmm. And just one more note, if you're taking warfarin, Coumadin,
Right.
Especially important to monitor your doses of that, because that's, as far as I understand, the only real interaction, aside from maybe your psychostimulant medications and psychoactive meds. But in any of these cases, I know we're not here to prescribe for an individual. That's to be done between a physician and an individual. Just, this is general information for the purpose of education. And so that's the real benefit of a platform that we have, is you have access to us so readily to answer specific case questions, because every individual is different. Everyone is going to process THC and CBD slightly differently. The experience will be a little different. And again, it's just important to note, like if you said, if you have an overstimulated experience from too much THC, that being the psychoactive component of cannabis, that are ways to keep yourself safe, like being in a quiet place with gentle music and having something sugary to eat to help bring down the experience, taking a nap or resting. We do know that cannabis overdose, while uncomfortable, is not life-threatening. So that's, where you said there's huge differences between opioids. It's exactly right. If a patient gets off their opioids and comes back in at the same dose they left at, that could be a life-threatening overdose. And so cannabis is proven to help decrease the amount of opioid daily requirements that patients have. So we're seeing it as an alternative pain control that's going to be, although not pleasant for pharmaceutical companies, pleasant for the actual, person ingesting. They're going to have a safer experience.
And then I think one other thing that, as you're talking, that to literally let everyone that's in California that might want to talk to a doctor about these topics is that, one of the biggest demographics of folks we're seeing come into CBD and THC dispensaries are women, right? So if you're a woman out there and you want to talk to a doctor that can, really give you a woman's perspective on these medications, on CBD, on THC, Dr. Alavi is an awesome resource for that. Because cannabis and CBD and hemp are such a powerful armamentarium of substances, I think, for a woman's health. Wouldn't you think, Dr. Alavi?
Definitely. I mean, from everything from like assisting with libido and sexual arousal and all the way to improved mood, helping symptoms of menopause, helping, neurodegenerative symptoms, basically working on making you an all-around more balanced individual. I think that there's a role for cannabis there. Now, it might not mean, like the typical stereotype of having to smoke all the time. It can be as simple as applying a spray, sublingual, just self-medicating as needed with a prescription and for, physician check-ins as needed. But I think a lot of women, we're just more intuitive beings, but we also are very high pain thresholds. We have high pain tolerance. That's why we're fit for giving birth. But at the same time, a lot of our pain and emotional needs can go unmet in a society that's predominantly masculine driven, that's rewarding of the person who goes back to work and pushes through it and doesn't talk about their emotions. So cannabis can very much be healing for couples and for the relationship the woman's in, because females tend to really place a lot of importance on that. If your relationships and your immediate surroundings aren't going well, everything else can crumble. We're very empathic beings. So, cannabis is a tool for, breaking down those barriers, being able to talk to your partner openly and honestly. It's kind of like what I think of as a natural couples therapy as well. So there's use for cannabis in the sphere of therapeutic talk therapy, just like there is MDMA and psilocybin, the active ingredients in mushrooms that are all being shown to be very effective on a number of levels. So,
well, lovely. Hey, Jason, let's take that next question, and then we've done about 30 minutes, so we can kind of wrap it up after the next question and let Mom get back to her daughter.
Yeah, so this is a question for both of you.
Okay.
What kind of questions should we be asking our family doctor about using CBD?
All right. I'll jump right in and then I'll let Dr. A take it away. I think you should really be talking to your family doctor about seeing how comfortable they are and where their knowledge base is about CBD, cannabis, hemp, and other non-psychoactive cannabinoids. The research really is so good, and it has been around for long enough now that the doctors you're seeing really should have some sort of an appreciation of the science of CBD, THC, full spectrum, and isolate products. They should have an understanding of that. So I think it's an important conversation to make sure that your doctor is aware of that, because it's just kind of their job now to give people this really safe option and understanding. So I think first is having a conversation to see if they understand it and if they can even help you. And if not, maybe ask them to read up on it a little bit for the next visit, and if they could talk to you about what some of the options would be if you think they're a good doctor. And then besides that, going over what other medications that you're on, right? We call it a medical reconciliation or a review, like maybe going through the medications that you're on with your doctor and saying, is there anything that I'm taking that you think could be reduced or could be helped by, cannabis, CBD, or hemp? So I think those are some easy ways to kind of start that conversation, or simply tell your doctor that, you're going to start using it. And is there anything that they'd like to keep track of while you're doing that?
Mm-hmm. Yeah, I want to second what you just said, Dr. D, and also that a lot of good literature is showing that patients should not be cut off any other pain medicines as a result of using cannabis or THC. Like if your urine tests positive, no longer do we think that that's a reason you shouldn't get your normal hydrocodone dose if that's what you've been requiring. So a lot of people have fear about talking to their doctors because they worry that they'll get cut off from their normal pain medicines. And so that is less in favor than maybe in the past. And I think you're right. We need to.
Yeah, I think it's good. The people out there have to know that, all of us doctors out there are not anti-cannabis. If you're open about it, you'll find somebody that's open about it in your community somewhere. And so don't be afraid if someone isn't open about it. You can find people that are. Sometimes you do have to make a couple calls.
Yeah, and you're absolutely right that starting that dialogue about being honest with the physician that you're curious about this and you want to see how much they know and how comfortable they feel advising you. And a good physician will be honest and say, I do or don't feel comfortable. And so it's important to see there, because then you could always call in and get a medical recommendation with one of us to get more information and then relay that information back to your physician. But at the same time, they need to be keeping up on current medical education and topics. And this is a hot topic that I think it's important to stress with them so that they get enough questions from enough people to say, hey, I really should go do a medical education class on this. Every physician's required to do, I think, 150 hours over a period of, 2 to 4 years, depending on the board. So it's going to be important to kind of hold our practitioners accountable and go through the med recon.
And you have to remember, folks, that not only do doctors have to get educated, but even when you're, say, in med school and you're learning about a drug and the dosages and all that sort of stuff, you really don't get comfortable, right, prescribing that drug until you've prescribed it to 100 people and you had feedback. Oh, this didn't work. I didn't feel it. It's too much. I had a side effect, this or that. And then you have this kind of what we call, our clinical acumen of knowing kind of where a lot of the folks are falling in certain how they're responding to drugs. And so if you have a physician that just hasn't had that sort of experience yet, it can be hard for them to guide you and be like, yep, you know what, go ahead for the first 2 nights at home, take 2 milligrams of THC for the first 2 or 3 days. I mean, one of the most interesting things I've seen in the literature, Dr. A, was that there was a study done, I believe it was a study done for smoked cannabis for end of quality of life pain in cancer patients. And when they titrated the patients over like 2 to 3 or 4 days, they would take 1 inhalation and that was it. Even if they didn't feel anything the first, 8 hours and the second one, if they did a slow titration like that, almost all of the side effects, anxiety, such things like that, went away from the THC. So these are the sorts of little tidbits in coaching that can all of a sudden change the whole response someone has to THC, cannabis, hemp, CBD, and make it a viable and effective option instead of someone having, oh my gosh, someone give me an edible and it was terrible. So there are some serious nuances to this as everything comes onto the market.
Yeah, in general, I say take half of the dose you think you should take. You can always take more later. Give yourself 20 minutes between inhalations and give yourself, up to 4 hours after some kind of ingestion, because everyone digests differently at different rates. I would echo all of that. And, back when we were kind of learning about this, arrowid.org was one of the most reputable sites on the web for information because it was compiled by probably hundreds and thousands of users who had, the gift of wanting to educate and share. And so there's a lot of great information there that I don't think, other websites really come close on that. I know I've used Leafly a lot for just trying to figure out what are the side effects with certain strains that are associated. Cannabis can be used to lower blood pressure. So, but again, important to talk to a physician. Yeah. Because if you lower blood pressure too quickly, like you said, titrating is part of that process. Slow and steady wins the race here. Slow and low.
Well, everyone, I think that is really a lovely kind of nice introductory talk with Dr. A. Hopefully as we bring the EaseMD telemedicine platform, the Dr. D now telemedicine platform back to life here in California, we can do, a show or a little talk with you every month or every couple of weeks, and you guys can get to know us better and what the service is all about. And, really, I think it's people like Dr. A. We enjoy the community that medicine brings. We enjoy the community that the plant brings. And we really invite everyone to, come hang out with us and get to know us. And what else, Dr. A? Any other words of wisdom before we
no, I'd love to do this on a more regular basis, because I think each of the topics that we brought up, even briefly, could be another, hour show at a minimum. So there's just so much information. There's so many exciting advancements going on right now. In general, I think medicine's moving to a more positive direction where, like you said, the client and the physician are both getting more educated to even some of these more ancient modalities that have had their proven benefits. So it's exciting to see the research kind of slowly catch up. And now we're knowing what we intuitively knew back then, that these are
and to have these modalities too, where we can unleash some of this science that either doesn't have the dollars behind it to be marketed yet, and really get the word out, because we can help a ton of people through technology, and being able to get information out. Right, one of the other guests that's so important to have on here are some of the leading researchers in the vape industry, right, and letting folks really know what some of the real world vape literature is out there without just hysteria, just like coronavirus. So, yeah, Jason, any other housekeeping items before we rock and roll back to work here?
Yeah, I think somebody was joking on Twitter. They asked, how do I know if I have coronavirus?
If you have it and that's right, you're well enough to know. If you have it and you don't have any underlying health conditions, don't go infect everyone else at the emergency department.
Right. I just want to remind everybody.
Yeah, I'll be showing up there later this month. We'll see what the ER is like where I am in New Orleans. St. Bernard Parish, actually. I want to put in a plug for the docu-series on Netflix called The Pharmacist. If you haven't seen it, I think you should. And I'll be working in that part of town. We'll see. I mean, it's a huge, that was the site of the first opioid epidemic in this country and the first pill mill, so to speak. It's kind of an incredible eye-opener where a pharmacist goes and basically tries to hold Purdue Pharma accountable, as well as the physicians in the community who are abusing their prescribing powers.
For sure. Well, that is another really interesting topic. And thanks so much, Dr. A. Have fun supporting your partner and taking care of that beautiful baby girl. And let's all get together soon and do this again.
Okay, most definitely.
Thanks, Dr. Alavi.
Thank you. Have a great day.
Everyone, remember, we're broadcasting to 8 different platforms right now. So be sure to like, share, follow, subscribe, and we'll see you next time.
Thanks so much, everyone. Cheers.